COVID put our emotions down. Talking about my generation. COVID tried to close schools down. My generation.
Yep, it's been 2 years of being in pandemic mode, and it hasn't been easy for anyone, especially kids. That's why some people are calling the youth of today the COVID generation, or Generation COVID. Gen Z for short. But what does it mean? And how has the COVID-19 pandemic affected kids like you and me? This is KN Explains Generation COVID. So, let's start with the basics. On March 11th, 2020, the World Health Organization declared a pandemic because of the spread of the novel coronavirus that causes COVID-19. That same month, schools across Canada started closing their doors, and kids transitioned to virtual and at-home learning. Back then, we had no idea how long this pandemic was going to last. Between March 2020 and March 2022, the government has counted over 3.3 million cases of COVID-19 in Canada, and over 36,000 deaths. Worldwide, one study estimates that over 5 million kids lost a parent or caregiver to COVID-19. From the loss of family members to the uncertainty of school closures, kids have been dealing with a lot, and experts say it's taken a toll on this generation. Hence, our topic of discussion. You may have heard the term Generation COVID or Gen Z being thrown around during the pandemic. But what does it mean? Gen Z is a label that has been given to kids who have had part of their childhood affected by the pandemic. It can include babies who were born in the past 2 years, all the way up to people who started college under COVID-19 restrictions. While experts are divided about what ages should be included in this group, the one thing they all agree on is that COVID-19 has had big effects on young people. Some kids might not want to be restricted to a label, but generational labeling has been happening since the early 1900s. Generations are often defined by shared experiences. One example is the greatest generation, kids who grew up during the Great Depression and the Second World War. Generational labeling can be used to categorize trends, lifestyles, and political views. Researchers can look at those trends to help better understand what different age groups want or need, and to make predictions about the future. To better understand what has been going on with the kids of Gen Z, I spoke with 3 experts.
I'm Dr. Jennifer Crosbie. I'm a clinical psychologist and researcher at the Hospital for Sick Children.
Hello everyone, my name is Joseph J. Smith and I'm a high school administrator.
So my name is Sara Austin. I'm the founder and CEO of Children First Canada.
The first area where Gen Z was hit the hardest? Well-being. According to Jennifer Crosbie, 70% of kids her research team studied said they were feeling more anxiety, had worse moods, more irritability, and more difficulties with inattention or hyperactivity. Many of those effects can be linked to social isolation. As kids transitioned from in-person learning to virtual learning, they experienced a lack of in-person connections, especially with other kids their own age. Recreational activities and opportunities to socialize are a
Really important part of emotional well-being.
Another area of concern? Physical activity, or the lack of it. Crosbie's team of researchers found that over the course of the past 2 years, increased screen time had a variety of negative impacts on kids' moods and behaviors. Kids who were active before the pandemic and kids who had access to activities during the pandemic did better overall, according to research. And it doesn't all have to be sports either. Any activity that gets us off the couch or away from doom scrolling can help. That's why Crosbie says that families should make plans to go outside, participate in activities, and have good social interactions with people, minus the screens. Next, online school. OBS. Going virtual was a necessity for many students throughout the pandemic. But research shows that lots of kids were
dramatically less successful in the online form as opposed to the in-person space.
Smith also points out that some groups of young people were worse affected than others. For example, kids from lower income families, newcomers with language barriers, and BIPOC kids. Research shows that families who are struggling before the pandemic struggled even more during the pandemic. So some kids have had a much harder time than others, which means some are going to be better equipped to return to school and to move on, but that
Not everybody's ready for the return, and not everybody is able to deal with all the things being thrown at them.
So how can kids get help if they're feeling behind in school? Kids should seek out help from their school and see if there are special services being offered. At Joseph Smith's high school, for example,
There are all sorts of tutoring services being developed and designed to uniquely cater to this particular issue.
some of this help can include course credit recovery, peer-to-peer mentorship, and counseling. If you're feeling a little rusty, there's nothing to be ashamed of. Everyone works at their own pace. Asking for help is the best way to get help. As restrictions lift, it can start to feel like things are getting back to normal. And while that can feel really good, it can also be kinda scary. First off, let's just say this loud and clear. The past 2 years have been really hard. And it's okay to not feel ready about things going back to normal, and to still feel a bit weird about things opening up. As restrictions come down, that also means masks are coming off. It can be pretty exciting for a lot of people. Woo! But some groups are concerned that mask mandates might be coming down too fast.
The Canadian Pediatric Society and many children's health organizations have urged governments to delay the lifting of masking mandates in schools because of the harms that could be caused to children.
Some worry that lifting mandates, while many kids still aren't fully vaccinated, could risk exposing children to COVID-19. And as different people have different levels of comfort, it's important to not put pressure on each other.
People, I think, really should kind of move at their own pace.
Things don't have to go back to pre-COVID norms just like that. If you feel anxious, you can ease in. Crosbie says kids can start small, like going out with family. Make a plan, do the plan, and then build on it as you get more comfortable. Another piece of advice is to reach out to people you trust and talk about how you're feeling. It can be anyone, family and friends, a teacher or a coach, and also medical and mental health professionals.
And if you're struggling with your mental health issues in particular, to not delay seeking help because your life matters.
There will be many programs and supports that kids and families will need moving forward. One of the main areas will be in mental wellness. Mental health help can be hard to access. That was true before the pandemic and has become even more difficult as more kids and families seek help. In just the first few months of the pandemic, the Kids Help Phone reported a 350% increase in calls. Crosbie says that hospitals, like Sick Kids, need more resources and strategies to identify who needs help earlier. Some are calling on all levels of government to do more.
I think there have been a lot of good intentions by public policy leaders at all levels, but sadly I think kids have been left far behind. It's time to put kids at the heart of our pandemic recovery plans.
As for the future, more research and studies will continue, even once the pandemic is declared officially over. As Generation COVID grows up, we may see more ripple effects from the pandemic.
I think as we move forward in 5 or 10 years, it'll be interesting to reflect on what the impact was overall. And there probably will be some kind of big group-based impacts on those kids and youth.
Like all of us, I don't know what the future holds, but we're not the first generation to go through tough times. And it's nice to remember that none of us are in this alone. For now, I will be doing my best to be considerate of the feelings and the comfort levels of those around me as we all deal with the losses of the past 2 years in our own ways. That's it for KN Explains. For CBC Kids News, I'm Ameko Carroll. The information in this video is based on research and conversations with experts. Thank you to Jennifer Crosbie, Joseph Smith, and Sara Austin. Information and background research came from sources like Sick Kids Hospital, the Government of Canada, Nature Research Journal, Lancet Child and Adolescent Health Journal, and the Stanford Center on Longevity.